From the very beginning, we knew it was going to be a challenge with the federal correctional facility. It's a very difficult environment to effectively isolate people who are ill from others, and we know that that's been part of the issue. One of the reasons why we're seeing the increased numbers today, however, is over the last few days we have been systematically testing all of the inmates and any of the staff who are have any symptoms at all. So we've been looking at if we can find people with minimal or asymptomatic or minimal symptoms for the most part. And so that's why we're seeing that big jump today. I think we are making headway in dealing with this issue. There are currently only 2 inmates who are in hospital at this time, but it is a very challenging virus, and it reflects how difficult it is to effectively isolate people who are sick within that type of an environment. And so we're hopeful that with these new measures, with the new infection prevention and control measures that have been put in place in this facility, that we're able to support everybody who's in the facility and make sure that ongoing transmission is stopped. But we know with the incubation period being up to 2 weeks that it's going to take some time before we see whether that has been effective or not. With regards to the poultry outbreaks, I think it really also reflects the fact that we have a more sensitive testing in our community. So the fact that we picked these up and that we were able to detect these outbreaks is a good thing in a sense. If they had continued to grumble along without us noticing, we would have had more broader transmission in the community. So that's where it's really important now for anybody who has symptoms that might be related to COVID-19 to connect with 811, to call your healthcare provider, to call public health, to isolate yourself and go for an assessment and a test if it's needed. Well, it's very challenging. There's different circumstances in the facilities as well. I mean, this is a medium security facility. The types of accommodations and living in it are different. People are there for a longer period of time. There's a lot of turnover in our provincial correctional facilities. And it is always challenging. By the time the outbreak was recognized in Mission, we were already behind in playing catch-up around it. As we know, people can transmit when they have very mild symptoms, and it may not have been recognized early enough. We've had some challenges, as we've talked about, in some of our coordination and communication between Fraser Health and the province and Correctional Services Canada. I know everybody is meaning to do their best on this, but being able to put in place all of the infection prevention and control measures, and my kudos really go to Fraser Health, who have been actively in the facility supporting the teaching and the importance of infection control, everything from wearing masks to enhanced cleaning and how that can be done in an effective way. So these were all things that we needed to reach and find the resources and the protocols to develop. I have been in contact with my counterparts from Correctional Services Canada, from the medical side, from very early on. And it is sometimes a challenge when you have different ways of doing things, and finding those seamless connections for things like people who have been discharged or being released from the facility, to make sure that we're notified in BC so that we can support people who were close contacts, to make sure that they are isolated and they have what they need to take care of themselves through the incubation period. So it has been a challenging process. I'm not going to sugarcoat it. And it's a very challenging thing to be able to support people who are in that type of a communal setting and to try and prevent transmission of infection.